In 30 years, I have bumped into so many products and programs and protocols. At this point in time, I myself take the DNA136 because I have tested it.
Boxes of it in his office, in his house.
I take it, my wife takes it, I shove it in my throat. Sometimes I don't like the taste. It's not the best tasting product. Sometimes it's disgusting in the beginning. But you know what? As disgusting the taste as it can be, how much money you put on your health?
That's right.
How much money you would put for your health? I think it's priceless. So you know what? I have been studying for myself, not the benefits of DNA, but how to make it in such a way that my palate takes it with pleasure. I have found that when I put it with extra virgin olive oil, it is wonderful.
I was shocked.
So I take it. To answer your question, do you take it for the rest of the life? Absolutely. If I am with no diagnosed condition, I'll take it once a day. When I'm doing seminar, I could take it 2 or 3 scoops. If it is an intense regimen with flying to China or Japan and I'm 18 hours on the plane, I bet maybe I take 10 scoops of it. Do you know the oxidation that happens in the air with those engines?
Yes, that's right.
Radiation.
It's terrible. It's cancer producing.
Well, doctor, so when you mix it with the virgin olive oil, you still do take the cod liver oil?
Yes, absolutely.
Okay, that's
absolutely. That's a good question. I should have said.
Three gel caps for every scoop.
You're right.
It comes along with it. 3 gel
You're right.
caps for every scoop. Several questions here. This man has been trying.
Jeanette Marshall.
Yes.
Doctor, I have a question here, and so far, I have taken in some incredible ideas. I have a problem, and I would like to know what can help it.
Okay.
And that is smoking. Now,
Okay.
that it leads to cancer. And
Are you registered with the Cellular Health Foundation?
No.
No. First step is, if you may allow me, because I need to be practical here. First step is you register with the Cellular Health Foundation. You ask Jonathan how to do. I don't take care of these technical issues. You register with the foundation. Next step, once you become a member, you submit to the foundation a question to the doctors, question to the experts. You submit exactly that question. You will receive.
I'm putting you
You
on.
will receive
Good to
a
see you.
highly technical answer, and that's how your question will be answered.
Thank you for coming.
That's the way to go. Because you are not my patient, I am not
I have it
really
marked.
authorized to, you know what I mean?
I'm looking at that DNA 136.
Yes, but you need because it's a special problem. Will this is recommended? Absolutely. This is recommended anyway. Now, if you want to help yourself also with the smoking, there is some additional protocol that can go with it. But in order to do that, just ask Jonathan. He will coach you on that.
Yep, it's a website. And in addition to the website, if you can't, for some reason, you're not able to get online for some reason, just use the, you can use the phone. It's a toll-free number, 866-728-8865. Okay? And you can call the number, and the forms, the registration forms can be sent to you by email or by fax or through the mail. Speak to Tracy. You want to get to Tracy. Tracy's direct extension is 1000, okay? So you always want to get to Tracy, 1000. All right, and that's how you can get the forms to get access to them. And we're going to take a few more, 1 or 2 more questions, but it's getting kind of late. Here's the problem. We want to make sure that everyone understands that Dr. Nkuzi is going to be in Atlanta. You know what that means? Does anyone know anyone in the Atlanta area?
Yeah.
Does anyone know anyone else who you wish had heard what Dr. Nkuzi said tonight that could benefit from it? Yeah. So if you know anyone that could benefit, from the lecture, mind you, and obviously he's not going to cover every single thing that he knows. We'd be here for a whole year. But there's going to be information that's going to be presented that you did not hear today. So you're welcome and invited to come to the event in Atlanta.
Are there
You can
two
take one of these forms.
still in Conyers also?
Still in Conyers. But anyone who was here tonight Take one of these with you, and you do not have to make the $10 payment for pre-registration because you came to one of the events here tonight. Or if you go to the Atlanta Medical Center, and there's going to be a table there. We're just a brief presentation we're doing at the Atlanta Medical Center on Saturday. Even being there, you can also get the registration fee that's waived. Okay, so just take one of these with you and make sure that anyone that you know knows about the event on Sunday. That's the main event. You want to be there and tell everybody that you know to come to that event. Okay? I see there was one or two more questions here, and we're going to have to wrap up.
Okay. I'm gonna make this short because I know we're on time. In 2010, I became very severe tired and talked to Mr. Lewis here. She was telling me about Immunicare to take that. So I waited a year, so I decided to take Immunicare because I was so tired, severe tired, I couldn't even get to bed. So, make the story short, yeah, it worked and everything. So I said, well, after a year, I'm gonna get off of it. So when I did get off of it, I did get tired again. So now you talking about this year, it's 3 years. So I'm having all these symptoms. I was so severe tired. I thought about quitting my job that I have, I don't be that tired. And I started having acid reflux, and I started being very nauseated in my stomach, and clear always thinking, you know, but that's all type of stuff. And so I said, well, you know, I gotta go to the doctor, I gotta go find what's wrong. So when I went to my medical doctor, he had ran some tests because I told him on this side, feel like I couldn't breathe, like this side here was just dead. And when I'm in the bed sleeping, my heart just beating and jumping, and don't let me drink a Coke or something with caffeine.
Yeah.
You know, it's really be jumping. And so I had got where I really couldn't sleep. So I found out that calcium had built up in my body. I'm producing too much calcium. So a week ago, he put me in the hospital because he said, what you have, it could lead to a stroke. He said, you could stroke out with this. So I stayed in the hospital a week, and my calcium down and everything. So when I went back this past Tuesday, he said, we're back up to a 12. So he told me to go ahead and take this prednisone. I don't know why, but I said, I can't take it because it makes me sick. But I'm still taking it, but at the time, it really hadn't made me sick because he said, I gave it to you when you was in the hospital. But he gave it through my arm and everything. So I just want to know.
Keep the microphone near you.
Okay, I just want to know this Immunicare that I was taking, did it have anything like raising my calcium level up? Because I did take regular calcium too that I had bought from you guys.
Jonathan will answer that.
When it comes to, some folks have asked the question about Immunicare, whether it raises calcium levels. There's a tiny amount of calcium in Immunicare. If anything, Immunicare helps take calcium levels down because protein leaches the calcium. So it in no way contributed to calcium going up. So that would answer your question directly. However, if you want to correct any imbalances, you know, in the body, chemically and biochemically, then your best ticket, of course, again, become a member of the foundation. And DNA136, as you can see, corrects causes, gets to the root of the problem, and retrains the body to produce things in the correct balance. So you could, you know, be a good candidate for getting started on that. But Immunicare would not have contributed to calcium levels going up.
In other words, if you have a lot of calcium here, it's being held in place high because of all the other toxic elements and other disproportions, unbalanced level of other elements around it, holding it in that place.
Yeah, because he said that my vitamin D was extremely low, so he put me on 50 milligram of not Caltrate, nothing like that.
It's gonna be best for you.
Vitamin D, 50 milligram that I take once a week. Like
It's gonna be best for you
he
to.
said I'm gonna need it too.
It's gonna be best for you to make sure you submit the question, and then we can cover all of that with you. All right? Okay, one more question here.
Oh, nice.
I had craniology.
How nice. How nice.
Craniology, and I'm on the way for twice. And I
Yes,
was
you did
wondering,
good. Let me put that.
what you was throwing out.
Yes.
Excuse me, I'm sorry, Dr. Nkuzi, if you could turn your microphone.
Yeah, I am going to turn it
Okay.
off.
There you go. Dr. Nkuzi, we're trying to, Dorothy,
Sorry?
you're gonna have to wait just 1 second, Dorothy, please. Because, the lady's trying to ask a question.
Yeah, go ahead. Sorry.
I've had a craniotomy of the front left portion. It was done in the 70s, and after it was done, they let me know that they're not advanced, and to always see like a psychiatrist doctor. However, I'm on metazapine and sertraline. So do I need the whole thing since I'm not clicking right up here?
Okay.
That's a good question too. Can I respond to that? The bottom line there, again, just like with any other situations, if you contact the foundation with all that information, then it would take a little time to analyze it, but we can give you an exact recommendation as to what would be best for you to take. Now,
Not the DNA.
oh, the DNA136, understand something. Everybody will benefit from DNA136, either level 1, level 2, level 3, level 4, or level 5. Everyone will benefit from that. I take 2 scoops a day myself. It's unbelievable. I have had no health problems, but I won't take less than 2, per day. And I'm amazed at what it does. My sleep pattern has normalized. I don't need nearly as much sleep as I used to. It does amazing things for mental clarity as well. We're finding people with depression that things are starting to fire properly. Unresolved issues are starting to resolve. People are resting deeper. Things are starting to happen in many ways, and these are things the doctor can't directly say, so he has to be very careful about that.
It's not necessarily coconut.
It could very well be serotonin, dopamine, or any other of the enzymes that could be chemically off. But what you have to do is get to the cause. See, everything that's being done from the medical system, remember, is treating symptoms and a manifestation of deeper rooted problems. DNA136 helps everyone get to the cause of the problem. So always know that you never go wrong with it, basically. Okay? So listen, folks, we have to wrap up. And
Because
I
you
know
just
that-
got 4 minutes left on here.
Okay, excellent. So, for those who have been able to stay, we certainly applaud you, and everyone who's here right now, in the room, right now, you're going to be able to get a free 2.5 ounce bottle of the ImmuneRx, totally free. Okay, so you know what that means you have to do? No, we have to identify you, so we need to make sure that you know what we'll do? Dorothy, just make sure you give your name to Dorothy. And the foundation's gonna give every one of you one free bottle.
Dolores.
Yeah.
I'll give mine to Dolores.
Yeah, you know what I mean, Dolores. Everybody knows, I just got Dorothy on my mind, I'm sorry. DNA136? You can take it, DNA136, you can take it any way you want, but just always have to remember, 3 gel caps of the pharma grade cod liver oil. That comes along with it. We have them as a doctor, as a special. Anyone who comes to the doctor conferences, here's the code for you. If you want to get a discount on it, and everyone who's here right now will get free shipping on it. You stay to the end. Everybody who's in the room right now will get free shipping, plus you get a discount. The price is $180 for the 2 together, right?
The DNA and the cod liver.
Yes, ma'am. DNA and the cod liver oil is $180. You must take them together.
Yeah, it is part of the formula.
It helps the liver to process all those
It doesn't work
toxins.
alone.
Yeah. Okay, so your price, and this is your only shot at it, at getting this price, is gonna be $120 for the 2 together.
Can I give you a check?
Okay? We can't take any money now at all, but you work that out with Dolores. She has to have your name right now. And everyone here, you can buy as many as you want at that price for the rest of the month. Everyone who's in the room right now. Okay? $120 for the kit. But everyone also has an additional bonus because you stay to the end. You get the free 2.5 ounce bottle of the ImmuneRx. So give yourselves a hand.
Amen.
And thank Dr. Nkuzi.
Thank you. Thank
Was that
you.
phenomenal?
Thank you. Thank you for coming.
And one other little thing for everyone who's here, you're going to be able to get a copy of the actual lecture also. Okay.
Excellent.
So, but You must not make any copies of it. It's only for your personal use, those who are here.
Solus?
Understand something, folks. This code is not set up yet.
Yes.